All right, let's start now. Okay, so basically, firstly, before going on to start with the revision course, uh, let me tell you, we are going to roughly cover 100 scenarios, but actually not 100, maybe more than 100 scenarios, because I plan to keep telling you that what are the different scenarios which are presenting in the same way. So it's just that the patient is different, his concern might be a little bit different, but you have to approach that scenario in the same way. Let's suppose, for example, just have a look at our first scenario today. You've got a medical colleague. He has some issues. It may be that he's getting late, or he's taking some alcohol or cocaine, or he has posted something on the Facebook about a patient, and many others in the GMC. Try to think of it to be scenario that you have in your real practice when you're working in the UK. When you think of the scenarios like that, you'll be able to perform better. You'll be able to think better. You'll be able to come out of your anxiety that you have with regards to the GMC questions or the scenarios. It's not about questions being repeated. If we talk about many of the scenarios, about 99% of the questions in the GMC or in any international exam, they are being repeated one after the other. Why don't they change the questions in every exam? Because let's suppose, for example, this late colleague, all the candidates who we have in today's meeting, they are going to approach it in a different way. All right. So they want to see that what's our approach, what's the approach of each candidate, how much does he or she understand about the situation, that how he needs to deal with a medical colleague. May he be getting late, or he is taking alcohol, or he is using Facebook, how we need to convince them over certain points. So basically, this is more than ethics. This is a type of counseling scenario. You need to counsel. You need to be able to counsel your colleague that he should not be coming late. You should be able to keeping your ethics in place. You should be able to counsel your colleague that he should not drink alcohol when he's in the workplace. You should be able to counsel your colleague that posting something about the patient on Facebook is unethical. That is something which should not be done by a responsible doctor. So our duty of care towards our colleagues is that we want to make them aware of how they should be working in the NHS hospitals. We want to help them out. We are not going to go in with a blame game in our minds. We are going to go in like a friend, like a colleague, trying to convince them, trying to make them understand that what they are doing is wrong. So, for example, if we talk about any one of the scenario, it's not talking about one scenario. It's actually a structure that needs to be followed in all the colleague stations. I hope you guys are understanding. So one by one, we are going to discuss many different scenarios today. At the same time, telling you that let's suppose, for example, a concerned mother is coming to you to discuss something about her daughter. Similarly, another scenario, concerned father is coming to you to discuss about his daughter's depression. They can put in something different as well. They can put in some new scenario as well, in which the father or the mother is concerned and they are asking you, they are demanding you to disclose the information that you have with you. What do we need to do in all the scenarios in the GMC? We always need to maintain confidentiality. We always need to be a safe doctor. May it be an ethical scenario or it's a counseling scenario, remember that the most important thing that they are looking in a doctor who needs to work in the NHS is that he should be a safe doctor. That is the most important thing of all. Let's start with a medical colleague. A medical colleague coming late, he might be a final year student or a fourth year student. First of all, you go in, you acknowledge where you are. You are working in medicine department. Darren, a final year student who is a part of your medical team, is coming late. So see, this is so important that he is a part of your medical team. So you're not going to be blaming him. You're not going to be talking to him in a way that he is junior. He's a part of your medical team. Is coming late to the ward. Your colleague has also noticed this. So this statement is just to support you when you're talking to your colleague. How are you going to approach this situation? You need to talk to him in a private room, not in front of other patients, just to convince him to come on time, because he has some duties of care towards the patient. If he is a medical student only, he might not have any duties to perform, but he might miss very, very important whiteboard meetings in the morning, or he might miss some important information that is being delivered by the morning meetings, right? So how are you going to approach this case? You go in, you build a rapport with your colleagues, not the way you build a rapport with your patients. You go in, you go, hello, Darren, I'm Dr. XYZ, one of the doctors working on the same floor. After building a good rapport, you always ask the patient, do you have an idea why I arranged this meeting with you? So this is the second point after building rapport. After asking him, how is his rotation going? Any challenges, any problems, anything like that, always ask him, do you have an idea why I've arranged this meeting with you? No, doctor, I have no idea. All right, that's fine. Would that be all right if we just sit down in a separate room and talk for some time? Yes, that's fine. Then you go on to talk to your colleague. If he calls you doctor, you may ask him to call you with your name just to make him more comfortable. Ask him, it's okay, you can call me with my name, Noor. You can call me as XYZ, whatever is your name, you can just ask him to call you with your name. Okay, then you go on to sit in a separate room and you start taking history from the medical student. Now you might be wondering, what history? He's a colleague. Yes, you always need to take a history. May it be a colleague. What kind of a history? Obviously, you can't be going in and talking to him about Maftosa or about DESA. What you need to take him. So how has your rotation been going? What time do you come in the morning? What time do you go back home? Have you had any challenges while learning? Have you had any challenges while coming to the hospital at all? So you take your history in a way that your history will support your stance when you are convincing this patient to come in time. Once you've taken a good history, a short history, not a very long one, tell your colleague that I have noticed that you've been coming late to the hospital. Is that right? Just wait, let him respond. If he says, no, doctor, I've been on time every day. All right. Can you tell me what's your arrival time in the morning? It's 8 o'clock. What time do you come? At the maximum 8:05 or 8:08. I've never been more than that. All right, that's fine. So you've never been more than 5 or 8 minutes late. Is that right, Darren? Yeah, that's right. So once you've acknowledged that this student doesn't know the importance of 5 or 8 minutes that he's missing in the morning, you start taking a little bit of further history. So is there any particular reason that you reach at 5:05 or 5:08, or you're not able to come on time exactly at 8? Well, doctor, I don't consider that that I'm late with that. All right, that's fine. So Darren, I really have something very important to tell you. For a doctor, for a person who is working in the medical profession, each and every second, each and every minute is important for us. Do you have an idea about that? Well, doctor, because I do not have any responsibilities, I do not have any patient tasks, since I'm just a student. So I think it's okay if I'm a little bit 4, 5, 8 minutes late. Yeah, you're right. I understand where you're coming from. Okay, let me tell you. In the mornings, we have early morning sessions with our seniors in which many important points are being discussed about the patients, about different conditions. Then there are many whiteboard meetings. These are all very, very important. Many a times, some important points are being discussed in those meetings with important take-home points, and those points are never ever repeated again. They are never discussed again. So I really want you to focus on that. I mean, since you told me that it's just a 5 to 7 minutes late, I really want you to focus on the importance of those 5 to 7 minutes. What do you think about that, Darren? Pause, listen to his stance, whatever he says, then again go on. Yes, exactly. The morning time, the arrival time is very, very important. What are the other reasons that we should be on time? Another reason we should be on time is that if we make a habit of being punctual now, this habit is going to go with us throughout our career. It's going to give you a very good boost. It will give you good fame amongst your colleagues that Dr. XYZ is always on time. He's very punctual. He's always there for his colleagues, for his staff, and for his patients. So encourage him by giving all these important explanations and giving him all this information. Then you also need to tell him that 5 to 7 minutes. Hey, Darren, once you'll be working in the hospital, you know that to perform a BLS or to perform a life-saving treatment or maneuver for patients, we even do not need 2 minutes. Sometimes even 2 minutes given to a patient can save the life of a patient. So I really want you to realize that time is very, very important, especially for a doctor. If you ever get a chance that you give some extra time, that would be wonderful. But I will really, really advise you not to steal the time of the patients when you come late in the morning. What do you think about that? Just try to convince him, talk to him about all the situation. When he agrees, all right. If your colleague tells you he has no reason for coming late, then you only need to convince him by giving all these informations and explanations and try to convince him, try to counsel him to be on time. If your colleague during your history taking tells you that, doctor, I come to the hospital late because I live really far, he might tell you during history taking, I come to the hospital late because I come by public transport and I need to change many buses or trains. He might tell you that I live at a distance of 2 hours, or he might tell you that I really have very important tasks to do at night. Whenever he gives you a reason, remember that throughout the GMC exam, whenever a patient gives you a reason, any patient giving you a reason for anything, you always need to give a solution. That is your duty. Giving options. Remember that. Remember this word. Giving options to the patient is your duty in every case. May it be your patient, may it be your colleague. Whenever somebody is facing any problems, give options. What type of options? Well, Jaren, as you told me that you are unable to, you sleep late at night, I would highly suggest you to try to sleep on time. It will save you some time in the morning to reach in the hospital on time. Also put an alarm for yourself. And if you have any important activities that you're doing at night, try to reschedule them in a way that you are free at night and you are able to sleep well, because your freshness in the morning with the patients is also very, very important, that you have taken enough sleep. If the patient has, if the colleague has a problem commuting to the hospital, give him a solution for that. He can consider changing his route, going through a different transport, taking help from a friend who is also following the same route, or maybe consider talking to his senior. In this case, in this medical colleague case who is coming late, you do not want to fill in incident form, because incident forms only need to be filled when the patient's health has been compromised. This medical colleague, who is a fourth-year student or a final year student, is not dealing directly with any patients at all. So none of the patient's health has been compromised. So remember that you do not need to fill an incident form. You can always advise him to talk to his senior. Why does he need to talk to his senior? Just to let the senior know that he has been late and he might need some help coming early on time. If he wants, he can discuss with his senior, but always encourage him to discuss with his own senior, his medical lead, his educational lead, or whosoever is on his top. He can discuss his problems with him. Okay, and you are always there to help him out. Same is going to go with the alcohol colleague and the Facebook colleague. Since we are going to discuss just the late colleague today, so we'll move on to the next scenario. Any questions will be taken at the end of the session, so please keep your mics muted. Coming to the next one, concerned mother. We've got a concerned mother, the concerned father. They are similar type of scenarios. I'll roughly discuss the father and the mother, both the scenarios. So once this mother is coming to you and she's concerned, Mrs. Jordan has arranged an urgent appointment with you to talk about her daughter. Her daughter, Katie, is 15 years old. She wants to talk to you since she has some concerns about her daughter. Husband, mother, and daughter have been registered in this clinic for 15 years. This is the time this is the first time that you're seeing any from the family. So, any mother, any father coming to you with any concern, please listen to them carefully. Address their concerns. Be nice, be caring. Don't ever say a straight away no to any of the concerned relative. Never ever put a big cross on the word no in your dictionary when you're dealing with a patient in the GMC. So how do we need to approach it if we are not going to say no? All right. The mother comes in, you greet the mother, always acknowledge when she says that I'm worried about something, always acknowledge. I can see that, yes, you look worried. Is everything fine? After giving your introduction, after taking the details of the daughter and the mother, you start with the acknowledgement that she is worried. I'm worried because of my daughter, I noticed that there were some pills under her pillow, some oral contraceptive pills. All right. I can see that you're concerned about these pills. Can you tell me what is your main concern? Well, doctor, she's just 15. Why does she have these pills under her pillow? Or why does she have any barrier methods, any condoms under her pillow? She can ask you anything. All right, I can see that you're worried about that. So would it be all right if I ask you a few questions? Start with your history, as always. You can't miss on the history. All right. Can you tell me which pills did you see under her pillow? It was the oral contraceptive pills. Is it for the first time that you noticed them? Yes, doctor. Did you talk to your daughter about it? Yes, doctor. I tried to talk to her. She just slammed the door on my face and went out of the room. All right. I'm really sorry to hear about that. She behaved with you in that way. So what did you do when she went out of the room? Well, doctor, nothing. I just wanted to come and talk to you about this. All right, it's very good that you came in here with this concern. Apart from the pills or the way she behaved with you today, have you noticed any other changes in her behavior recently? Have you noticed that she has new friends? So you are just taking history from a concerned mother because you want to calm her down and make her understand the situation. You take a history, ask her, what did she do when Katie just left the room and went out, slammed the door on her face? Did she find out where she went? No, doctor, I did not. All right. So, Mrs. Jordan, young children are really very emotional these days. I would highly suggest you that if she has gone anywhere, try to call her, try to be calm while dealing with her, because you do not want her to harm herself in any way, right? So just show your pattern of being safe for the doctor like this, for the daughter like this. Going on, she'll be asking you, doctor, can you please tell me if she came here and one of the doctors from your practice prescribed the oral contraceptive pills for her? Like, why do you think that one of the doctors prescribed her the oral contraceptive pills? Because we have been registered only with your practice for the last 15 years. All right, that's very much right, Mrs. Jordan, that you are registered with our practice for the last 15 years. But did you ask Katie, where did she get the OCPs from? No, doctor, I did not ask her. All right. So I have something very important to tell you. Would it be all right if I tell you how we deal with young patients when they come to us in our practice? No, doctor. The mother might say, no, doctor, you just tell me if my daughter came here or not, and if one of the doctors prescribed her the oral contraceptive pills or not. All right, I can really see that you are too much worried and concerned if one of the doctors prescribed the oral contraceptive pills to your daughter. Mrs. Katie, I'm really sorry that I may not be able to help you with this information. Wait and see if he responds. But I can help you in many other ways. How does that sound to you? Doctor, I just want to know if my daughter came here or not. Well, Mrs. Jordan, whenever any patient comes to us, seeks any type of medical help or advice, we always try to maintain their confidentiality, to give them the confidence to see us the next time when they need help. Doctor, what do you mean by confidentiality? She's my daughter. I have a complete right to know everything about her. You're right. She's your daughter and you're a very caring mother. I can see that. But unfortunately, I may not be able to help you with the information that you are demanding. But I can help you by giving you the information that how we deal with these young people when they come to us to get any oral contraceptive pills. How does that sound to you? All right, so tell me, do you give them oral contraceptive pills when they are 14 or 15? She might be a little bit sarcastic or be a bit harsh. Well, thank you for letting me explain this to you, Mrs. Jordan. Whenever young people come to us, we always take a complete history. We take them into confidence. We give them confidence to talk to us and discuss any of their problems that they might be having. We always make sure that they are in a relationship with a person who they are safe with. We always try to encourage them to talk to their parents as well. We tell them that the parents are the best first and last resort for any child. So we always encourage them to discuss stuff with their parents. We do not refuse oral contraceptive pills or any type of contraception to young people. Do you have an idea why? No, doctor, why don't you? You should refuse. You should not give them. Well, Mrs. Jordan, if we refuse contraception to young children, they might start getting pregnant at a very early age, which would be more troublesome, more worrisome for the child and for the parent as well. In fact, we always encourage them. We always tell them that according to the law, the age for them to be in a sexual relationship is above 16 or 18. We always tell them that they should be, whenever they are in a relationship, it should not be under the effect of any force, drugs, or alcohol. We always encourage them to talk to their parents. This is the safe approach we take when we meet any young children. Wait and see how the mother responds. But doctor, we are from a very religious family. I do not accept this. All right, I can see that you are still concerned about that. So I really encourage you to talk to your daughter. Try to have a friendly relationship with her. Once she'll be friendly with you and you'll be friendly with her, she might start disclosing her problems, her relationship, her issues, the things that she's going through in this age. She might start disclosing those things to you. It's very important for us to be friendly with our kids. I can see that you're worried. Anybody in your situation would feel in the same way. But all the parents who are coming to us, I encourage all of them to discuss matters with their kids. It's very important for the safety of your child. Any other questions? Any other problems? If you have any other concerns at any other time, please do come back to me. I'm always here to help you out. This is how you end up this patient. See, you never refused the mother that, no, I'm not going to give you any information because the child is She's registered with us and her information is confidential. So don't be rude to any parent, any son, any daughter, any relative who is coming to you. Even if you think that he is demanding something that is not right. Coming to the next one, concerned father with a girl who has depression. Similarly, just like this previous case, you are going to take a complete history. May I know when did you come to know that she has been diagnosed with depression? What symptoms did you have? What type of a relationship do you have with your daughter? Have you discussed her problem with her medical condition with her at all? No, doctor, she's not telling me anything. All right. Is there any particular reason in your mind that she's not telling you anything? I have no idea. She's so nice. She's so caring. She does not want me to be concerned about her. She does not want me to be worried about her. All right. This father will be continuously asking you, demanding you for information about his daughter, that she has been diagnosed with depression. If you can give me the information that you have in your practice record about my daughter. Staying humble, staying nice, staying caring towards the father, you are going to refuse giving any information in the same way as we did with the concerned mother case. Tell him, I may not be able to help you in this way, but I can give you some help in the form of some ideas. Please look for these signs. If you think that she's low, look for these signs. If she hasn't come home for the past 1 week, please go and look for her, call her, try to contact with her friends. So this station can come in many different ways. Whatever way it is coming, you need to be a safe doctor, despite the fact that this is just a concerned father whom you are not going to give any information. You are not going to break the confidentiality. But at the same time, you need to be very nice and caring towards the father and be a safe doctor by giving him tips how he can look for red flags in the child and how he can help her by doing some therapy, talking to her more frequently, spending more time with her, and stuff like that. But then again, tell him that unfortunately, I may not be able to help you with any information in this case, but I can help you in another way. This is the way to refuse a patient who is coming to you in the practice or in the hospital, anywhere. Moving to our next scenario, scenario 3, angry relative. Angry relative. There can be many angry relatives coming in different ways. As we've already discussed, we are never ever going to be angry in response to their anger. You are a doctor, you are a responsible person. You always need to behave in a way that this patient who is coming to you today should always be able to come to you again. If you keep this strategy in your mind, you are never going to fail a station. So you are FI2 working in a GP, daughter of a 65 years old lady living in home care presented to you to know why she has not been informed about the dose reduction of her mother's thyroid medication. Daughter should have known about it as her mother has dementia. So when you start taking the history for this case, you go in, you greet the lady, ask her name, ask the name and age of her mother, and then you start your consultation that how may I help you? She will put forward this concern. Now, see, you have no other information about this case. Any case which you are unaware of, you have no information about any case, start taking a history. Ask her, can you please tell me a bit more about your mother? Like what, doctor, since when has she been in the daycare, in the home care? And how frequently do you visit her? Since when has she been on the thyroid medication? What problem does she exactly have? Does she have hypothyroidism, which means underactive thyroid gland, or does she have hyperthyroidism, which means overactive thyroid gland? I'm sorry. So you ask all this history. How is your mother doing at the moment? Any medical conditions that she has been diagnosed with? How frequently do you go to visit her? What is your main concern today? After taking a history about the mother, you start asking her concern. She'll tell you that, doctor, her thyroid medication, she had an underactive thyroid gland. She was receiving thyroid hormone, but this time her thyroid hormone, the tablet that she was given, its dose was reduced. I don't know what happened, and I was never informed about that. All right, so what kind of a history are you going to take here? Ask the daughter, can you tell me, is it for the first time that the dose has been changed? Yes, doctor. By any chance, had you given any contact numbers, any home address for you to be informed once any changes are made in her medication? She might say yes, she might say no. If she says no, I've not provided any number in the daycare, then you need to ask her to provide a number. Okay? If she says that yes, I've already given my phone number, that if there is any problem, contact me over the phone about my mother. All right, by any chance, did you change your address or change your phone number? So you need to be able to take a good history. You need to be able to inquire the case in a good way. If she says that, no, doctor, I did not change my home address, I did not change my phone number, nothing has been changed at all. All right, then that's a very valid concern. I really need to look into the cause, why you were not informed about it, and I'm really sorry. I highly apologize you on behalf of my colleague that he did not inform you. You are right. I really do not have enough words to apologize you over this, and I can really see that you are a very concerned daughter, that you wanted to be informed about everything. So would it be all right if I explain you some things further? Yes, doctor. So in the special note, an information would be given that this patient was hypothyroid, was receiving thyroxine, and recently her T3, T4 levels came out very high, because of which her thyroxine dose was decreased markedly. So you can give the whole information to the daughter in a very nice and humble way. Tell her that the dose was decreased because we tested her for her thyroid hormone levels. When they came up high, we just decreased the dose. And again, I apologize that you were not informed that. I will put a note in her documents. I'll put a note in her documents that you were not informed, and this should not happen again. I'll also discuss this matter with my senior colleague here in the practice, just to see if we can help you in any other way, what information we need in order to help you with new information in future. How does that sound to you? Do you have any other concerns? Are you satisfied with what I talked to you about? So you talk to her in this way. This is how you are going to deliver the information in a very calm, gentle, and humble way. All right. So if a patient is coming to you and saying that there's another case coming these days, late cancer chest X-ray diagnosis. It is almost the same, almost the same. You need to apologize, but never ever. So here is one tip for you. Put that into your minds. Never ever try to justify your colleague. It's not you. It's your colleague. You do not know what happened. You do not know whether this colleague called the mother to give this information or not. You do not know anything about how your colleague went about the new results. Similarly, in this one, there's another case in which the late cancer chest X-ray diagnosis. Now we are talking about different case. So remember, in this one, usually there would be you'll be in the hospital, and that's the son who is coming to you and saying that my mother is. He's coming for the chest X-ray findings for his mother, and he comes to know that a suspicious mass has been found in her X-ray, and he is very angry that I took my mother to the GP twice before, And the GP just said that it is a chest infection and he never did an X-ray for my mother. And this son is very angry. He can be over the phone, he can be face to face, but the son is very angry. When you find out that the son is very, very angry, please, please never justify your colleague. You are not there in place to justify your colleagues. All that you can do is you can apologize on behalf of your colleague. You can arrange a meeting with your colleague. You can tell the son or the father or the daughter, whosoever the relative is, that I'm really sorry for what happened. It should definitely not have happened. I'll take some steps to find out that why it happened in the first place and what we can do to prevent this from happening in future. This son who is very angry wants to know how I can make a complaint against the GP. So whenever you need to make a complaint against a GP, you always, whenever a patient wants to make a complaint against a GP, you always need to send him to the practice manager of that particular practice, because calls is for the hospitals, not for the practices. So for the practice problems that the patients have, any complaints about their GPs or anything like that, they're always tackled or dealt with by the practice manager. Okay, remember that. In this case, don't send him to calls. But the same thing, as I said in the previous scenarios and in the current scenario, please be nice, caring, don't justify your colleague, take a good history, apologize for not, that the X-ray was not done in the first place, and you tell him that I don't know exactly what happened, so I need to get in touch with the GP to find out that what happened and why the X-ray was not done. Do you want me to arrange a meeting with the GP? Doctor, I do not want to see his face. All right, that's completely fine. Do not force him to see the GP if he doesn't want to see the GP. It's okay. Take up their way. Take up their way. If he doesn't want to see, okay. If he agrees to see, okay. Thank him. Arrange a meeting. And for the complaint purpose, just send him to the practice manager. All right. So scenario number 4: concerned relative, dementia mom. And there's another case, there is another case, there's another case, so many cases where the relative is concerned. Whenever you find that the relative is concerned, please, like always, go in, paraphrase the scenario if this patient has already been admitted with you, as this one is in the neurology department. So always go in, paraphrase, take a recap, and then acknowledge that the relative is concerned. Always give options. As I said in the beginning, giving options is very, very important. You always need to give options to the concerned relative. What options? What type of options? In this case, let's suppose Mrs. Parker, aged 78, has been admitted to the hospital because of weight loss. She has been suffering from dementia in the last 3 years, and she has not been taking any food properly recently. All the investigations, including blood test, ECG, X-ray, ultrasound, and CT scan of the abdomen, are normal. Patient has been given some fluid, and she is able to tolerate it now. It has been decided that invasive and aggressive management is not appropriate. Palliative care has been decided by the consultant. She was very weak on admission, but she has been medically managed. Other information is that what you must do: please talk to the daughter, Mrs. Parker, take relevant history, assess her condition, explain her mother's present health status, discuss about further plan of management, and address her concerns. Please always focus on this area. What you must do. This is a very, very important area for you to know. If it has been written that address his concerns, which is a point which is not written in every case. Remember that addressing concerns is not written in every scenario. Whenever you find that it has been mentioned that address her concerns, it means that she has some concerns. And you always need to follow this part very religiously in order to complete your management. Your management is very, very important. One of the most common causes of failure is the management. So please focus on what you must do part. Coming to the scenario. In this one, you're going to go in, greet the son, and start talking about, greet the daughter or the son, whosoever is there, start talking about the mother, take information about the mother. She's Mrs. Parker, she's 78 years old. So how is your mother doing at the moment? Why was she brought to the hospital? When you ask for a recap, the daughter is going to tell you that she was not taking food properly recently and she has been diagnosed with dementia. She's going to give you this information. Once she gives you this information, why was she brought to the hospital? She was brought to the hospital because she had some loss of weight and she was not eating food properly. Okay? Always acknowledge. Whenever a son or a daughter or a relative is giving you some information about the relative, and you think that that information is a concerning information for that relative, always acknowledge. I can really see that you're a very caring daughter and you're really concerned about your mother. I'm here to help you out and I'm going to give you information about what is being done with your mother. Would that be all right? Yes. Then you start telling, after taking a complete history, a brief history, that when was she diagnosed with dementia, how much weight loss did she have, what type of foods was she tolerating. So do take a history about these, a short history. Then you go on to managing this case. How? All this information, remember that all this information that has been given to you over here is very, very important, and you need to deliver this information somehow. So you tell the son or the daughter, since you brought your mother here yesterday or 2 days back, you were concerned about weight loss, and we also got concerned. So we examined her and we did many tests or investigations for her just to find out the cause of her weight loss. We did some blood tests. We did an ECG for her. We did a chest x-ray. We did a jelly scan of the tummy. We did some scans of the brain and tummy. Fortunately, Mrs. X, all the investigations have come out to be normal. I'm really glad to tell you. Then why is my mother losing weight? That's a very valid concern. So the seniors, the consultants, they have realized that the cause of weight loss in your mother's case is dementia itself. You pause, let the daughter say something if she wants to say. Does that make sense to you? Okay, doctor, is she losing weight because of dementia? But dementia is not a weight losing sort of condition or disease. I understand that where you're coming from. Sometimes when patients due to dementia are not able to tolerate foods like they used to tolerate before, they do have weight loss. Dementia is not a disease, but it's a condition in which the patient can deteriorate every day. How have you been coping with all this alone at home? Do you have any help? Do you have any support? Any family members? Ask her, does she know, is she aware of the different types of helps that are present in the community for her? So now we are coming to the options that I already told you. All the GMC exam is mostly about safety and options. You start giving her the options. What options? Take a history, not the history, I mean, take some information about if she's aware of the different types of helps that are available in the community. If she says, no, doctor, I have no idea about anything. All right, Jessica, I'm here to help you out with the information. And do not worry, if you want me to repeat anything, I'll repeat that for you. And I'll also give you some reading material or leaflets at the end about all the information I'm going to provide to you. Okay? Then start telling her about the dementia daycare, the dementia home care, the dementia care homes. Tell her that the dementia daycare is a place where you can leave your mom for a whole day and she will be looked after by expert team of nurses, and you can pick her up by the end of the day. Let's suppose, for example, if you have an important piece of work out of the station, you can do that. There are some respite care services, some home care services in which you can have a carer coming to your home and looking after your mom. For example, if you're not present at home and you have an important piece of work and need to go somewhere. Then there are some nursing homes where you can admit your patient, your mother. She often says that she doesn't want her mother to be admitted. That's perfectly all right. I can see that you're a very caring daughter. It's just an option that I want to tell you about. At any point in time, if you feel that you are unable to take care of your mom, you are too busy, or the burden has been increasing gradually, and now you are unable to cope with that, you can always avail this option. Come to us, we'll give you information about that. In terms of eating, encourage her to feed her mom small feeds, preferably semi-solids. Try to deal with her just as she has been dealing with you when you were a small child. Be nice, kind, and gentle. Sometimes we can be harsh, we can be annoyed, we can get sick of caring for the elderly. And that is very natural as well. Sometimes because of the work burden, because of the responsibilities that we have, we can have those feelings. But please always try to be nice, kind, and gentle to your mother. Okay, so this is how you need to deal with this scenario. Similarly, baby not cared. You end up this scenario here. Baby not cared. So any child, any relative that, so here it was the mom who was not being cared, not being cared, not, here was the mom about which the daughter was concerned. Now here it's the child about which the mother is concerned. She thinks that her baby is not being cared of in the hospital. She found her in filled up with poo, and she found that the child was the child's nappies were not changed, and the child already has some the child is premature and is in the hospital for a while now. So in the same way, you go in and take a history. In the history, you also need to include the history of diarrhea. Okay, if the nappies were not changed recently, how has it been in the past? Were the nappies being regularly changed in the past or not? You take a history that what type of a stool did she notice? Was it smelly? Was there any blood inside? Did she notice any fever as well? Was it a loose stool or was it a formed stool? All those questions. So whenever you go in, don't get unidirectional. Always try to take history. You've got a word stool, take the history around stool. In this case, dementia case, you've got a word around weight loss, take history around weight loss. Okay, so always take your history. Whatever the relative is saying, you stick to your task. You have to take the history. Once you've taken history, apologize for what she has noticed. Apologize for if she's thinking that the nurses are being rude to her. Whenever any patient or a relative thinks that the staff members have been rude, maybe your colleague or maybe a nurse, always acknowledge that. Always give them a solution by saying that it should not have happened. I'll definitely look into the matter. I'll talk to my colleague and see that why he or she behaved in that way. I'm really sorry for your experience in the hospital. I'm here to help you out. I'm going to look into the cause of the motions, of the loose motions that your child has. And I'm also going to look into the cause of why the nappies were not changed. I'm really sorry for that this happened. She might demand you something like fixing a nurse for the child. Tell her that nurses keep changing, their duties keep changing according to the rota. I may not be able to do that. Same way, as we discussed earlier, never refuse a question. I may not be able to help you in that way, but I can help you in another way. I can ask the nursing head or the matron to come and look into the matter more closely, and we'll be looking at your child more closely from now on, and we'll keep updating you about his condition. Don't make any false promises that you can't stick to later, but give options to your carer, the carer of the child in a good way. Okay, that's about it. So many cases in which the concerned relative is there, you need to deal with in the same way. Coming to the next one, demanding treatment. Any patient, any case, when there's a demand for the treatment, what do you need to do? You always need to take a history. As I said earlier, please, any case in the GMC, merely any case, you always need to take a history. Sometimes it's a short history, other times it's a long history. In this case, where the patient or the relative or somebody is demanding some sort of treatment, it might be, or investigation, demanding something basically. So if he's demanding treatment, like OCPs in this case, or the patient might be coming in demanding for antibiotics, the patient might be coming in demanding for CT scan of the brain because he has migraine and he's scared that he might be having a brain tumor. You always need to be able to convince the patient. Now your counseling skills are being assessed while you are being ethical at the same point. So remember that there is nothing, there is no station in which there is no counseling or no ethics. Every station needs to be counseled. Every station needs to be dealt with ethically. So keep your ethics and counseling in every station. Stay positive. When a patient is coming to you in the GP, 27 years old Jessica is demanding treatment to stop her menstruation for 6 months. Start with your history. Hi Jessica, I'm Dr. XYZ, one of the doctors working in this practice today. May I please confirm your name and age? You confirm the name and age. Always go in with a nice smile, with a caring attitude towards the patient. So how may I help you today? Well, doctor, I need to travel to Australia or to Canada, and I want to stop having this menstruation for these 6 months because I'm going on a vacation. All right, that's really good to know. You're going to go for a vacation. So for how long is this vacation? It's for 6 months. Wow, that's great. So have you already planned for it? Yes, doctor. All right. So are you alone or do you have? So you are trying to be just behaving normally. Don't straight away jump to the treatment that she has demanded. Okay. Here we do not have anything in the scenario. So have you already planned for a vacation? What activities have you planned for yourself? Well, we are going to go hiking. We are going to go this and that and blah blah blah. All right. And are you going alone? No, I'm going with my husband and with my kids or blah blah blah. All that. That's really good to know. It's very important to have some good time, especially in these COVID times when there's a lot of stress around. It's good that you're going to have some time for yourself. All right. So you told me that you want to stop your menstruation for 6 months. Can you tell me more about that? Yes, doctor. I want to stop it because I do not want to have any menstruation. I want to enjoy my trips. All right. That's a good thinking. And Jessica, do you have any specific medication in your mind? Well, no, doctor, I do not have anything specific in mind. But one of my friends told me there are some specific pills, some oral contraceptive pills that can be used to stop the menstruation because she had some menstrual problem. Wow, you've come in with a very good information. Really good to know. Yes, Jessica, that can be used. So before prescribing you any pills, I would like to ask you a few questions. Would that be all right? Yes, doctor. Have you ever used pills before? No, doctor. So it's the first time you're going to use. What kind of a contraception have you been using in the past? Just condoms, or she might tell you something else. All right. So at the moment, are you using any? No, doctor. All right. And have you? And are you in a regular? Are you in a relationship at the moment? Yes, doctor. Is it a safe relation? Do you practice safe sex? Yes, doctor. Ask all your 4 P's history. Once asked, tell her, Jessica, I would like to do a quick examination. Okay, sorry. Rule out the contraindications for giving OCPs. Once you've ruled out the contraindications, what are the contraindications? Contraindications are any migraines with aura, any heart disease, any current breast cancer, any active liver disease, and DVT in the patient herself, not in the relative. I'm talking about the patient herself. These are absolute contraindications. Okay, having migraine without aura is a relative contraindication, but the ones that I just told you, they are absolute contraindications. She tells you she doesn't have any of these conditions. All right, quickly go on to your Mactosa, ask her about smoking, nutrition, alcohol, then you go on to your management. Thank you for coming in to seek help for stopping your menstruation. And I'm sure I'll be able to help you with that, Jessica. As you said, these OCPs, yes, they can be used for stopping the menstruation. And you told me that you've never used them before, right? Yes, doctor. So as you want to just stop your menstruation, please keep using barrier methods to prevent any sexually transmitted infection or any pregnancy. So here, if you look into the matter, it's a little more than confusion. Sometimes we get confused whether she wants to stop the menstruation, or we get confused and we start dealing it as a contraceptive case. She is not here for a contraception, remember. She is here just to stop her menstruation fully for 6 months. To tell her that I can prescribe you OCPs after talking to my senior here in the practice. But ideally, these oral contraceptive pills should not be taken continuously for more than 3 months. So, Jessica, every pack has 21 active pills and 7 inactive or dummy pills. You need to skip the dummy pills. You need to use the active pills continuously, but not beyond 3 months. Whenever we use them beyond 3 months, they can cause some trouble to our heart, to our legs. I do not want anything like that to happen to you. All right? So tell her, give her this information and tell her that since I'm prescribing you these pills for the first time, I would highly advise you to book a telephonic appointment with me or with any GP or in the hospital, whatever you want to say. To try to book a telephonic appointment after 3 months' time, because we always need to follow up our patients after 3 months. You can have some headaches, some diarrhea, some breast pain, sometimes even some irregular vaginal bleeding. But if you'll be taking them continuously, you won't have that problem. But these are the side effects that patients can have in the first 3 months. If you have any problem, any trouble, you're always welcome to book an appointment and talk to us over the phone. So you need to be clear about what you are doing for the patient. Don't give her non-stop oral contraceptive pills for 6 months. Tell her that she can only safely use, you are a safe doctor, she can only safely use 3 packs in a go. Do that for her. Tell her to look for any clotting in the legs. She's going to travel. Be a more caring doctor. Tell her to keep moving in the plane as well when she's in the flight, just to prevent any clot formation in her legs. And then just the caring things. Okay, have a good flight and have a good trip. I really wish you best of luck. I hope you have a good time. If at any time you have any concerns, please come back to us. Give her red flags and then send her. That is it about this case. All right. So similarly, if it's a case of antibiotics, you need to rule out you need to check if this patient actually needs the antibiotics or not. So you need to take a complete history, complete examination, and then see if this patient needs antibiotics, give. If this patient doesn't need antibiotics according to her or his current condition, don't give. If this patient is demanding for CT, tell him that what are the possible side effects of CT scan. It is equivalent to about 700 X-rays. It's going to be a very high radiation. According to what you've told me, it doesn't seem like a brain tumor. I can see that because it's on one side and it's really intractable pain and you're unable to carry out your daily activities. You need to sleep in a dark room and stay away from sounds. These are very typical of something we call as migraine. It is a very distressing situation. But as you told me, we always look for weakness in a part of the body or problems with vision or hearing, and you do not have that. I'm really happy to tell you that your examination was normal, and it doesn't look like a brain tumor at all. You actually do not require a CT scan. And Jessica, I want to tell you that CT scans can really be dangerous. They have very high radiation. Unnecessary radiation is always avoided. If she still insists you, talk about your senior. Never send her for a CT scan directly. Always talk about your senior. All right, since you're unable to understand what I'm trying to tell you, Jessica, I would want my senior to come and talk to you because you're in the GP. You do have senior colleagues. you are on a training job, you can always involve your senior, your supervisor, who is dealing with you in the practice. Okay, going to the next one. Missed investigation. Very, very important, very frequently repeated. Missed investigation and medical error, misdiagnosed pneumonia, sometimes misdiagnosed a missed MI and stuff like that. So approach to this scenario number 6 and 7, basically many cases: missed foreign body, missed blood sample labeling, missed blood sample itself, or misdiagnosed pneumonia. All these cases, or missed MI, all these cases need to be dealt with almost in the same way. But as I said in the beginning, these cases usually want you to give some options to them. Okay, what kind of options? We'll talk about them now. Let's go to the previous one. I'll take a sip of water, please. Okay, missed investigation. Usually, these cases now are coming as a telephonic call. You need to convey this information on the telephone. Either call this mother to the practice with the child, or to the hospital with the child, or you need to just call them and give this information. Or maybe the sample has been missed and you want to call them to come and give the sample again. Or it was not labeled and you are the one who are the one who missed labeling the sample. So whatever is the case, it needs to be approached in the same way. As it is coming as a telephonic consultation these days, I would highly suggest you to focus on a few points. When you are dealing on the telephone and the patient doesn't know that you are going to call to tell about an error that has happened, in these cases, the patient might call you and is unhappy because she had a discharge from the surgical wound, or mostly you need to call and disclose the error that has happened. Whenever you need to call, when you're calling, whenever I take mocks, I have noticed that many colleagues, they do not tell about the purpose of call. Please, when you are the one who is initiating the call for the first time, the other person who is sitting at home, busy in his daily works, might be driving, might be doing some important chores, doesn't know that you are calling to talk about something important. So the purpose of the consultation needs to be narrated in the very beginning. How are you going to approach this case? Any case with a medical error. So if something new comes as a medical error, please do not get confused. All of them have the same approach. You should have enough words for apology. That is it. And you should know the steps you need to take in order to rectify the mistake. So from the beginning, hello, I'm Dr. X, one of the junior doctors calling from the E&E. May I know who am I talking to? I'm Jessica here. All right, Jessica. I'm Dr. XYZ talking from the E&E. Can I please confirm the name and age of your daughter? She's Annie, 3 years old. Thank you, Jessica. Or Jane. So Jane, I can see from my notes that you brought in Annie in the hospital today morning. Is that right? Yes, doctor. So I'm calling to talk about the way she was managed in the E&E. Would that be all right for you? Yes, doctor. All right, before I go on to explain anything, I just want to confirm your home address. She'll tell you her address and the postcode number. She'll tell you her postcode number. Thank you very much. And is it the right time to talk to you, or are you busy at the moment? You want me to call you later? Whatever. I mean, you can just say one thing. Is it the right time to talk to you? Yes, doctor, that's fine. You can talk to me. And in case if the call drops, would it be all right to call you on the same number, or is there any alternative number? It's okay, doctor. You can call me on the same number. Thank you, Jessica or Jane. Jane, you brought Amy today in the morning in the E&E. Would you mind recapping quickly what happened? Why did you bring her to the hospital? She will give you her story. Whatever happened, she was playing with her brother, she was playing alone, or she was doing something when she started choking. I brought her to the E&E. The doctor in the E&E examined her, took a history, did an X-ray, and it was. I'm really glad to know that there was nothing, and we were sent back home. All right, that's really good to know that she was okay at that time. So since she has come back home, has she had any symptoms? No, doctor. Your duty doesn't finish here by asking the symptoms. Ask further history. Your history is still there to be taken. Has she had any choking again? No, doctor. Any cough or shortness of breath? No, doctor. Any tummy pain at all? No, doctor. Has she vomited? No, doctor. Has she passed stool? No, doctor. Yes, doctor. No, doctor. I mean, whatever she says, it's not necessary that she's going to say no, doctor, over everything. She might say yes. She might say no. Anyways, you go on after taking the history. I'm really glad that she's doing fine at the moment. So Jessica, I'm calling to talk to you about the way she was managed in the morning when you brought her here. Actually, I was the one. Whenever it's written in the question that you are the one, you are the culprit, you always need to narrate that in your consultation as well. So Jessica or Jane, well, you brought her today in the A&E, and I'm Dr. XYZ, and I'm the one who saw your daughter at that time. And I assessed her. She was doing fine at that time. I did an X-ray for her. And then I sent, after seeing that X-ray and sending you back home, I sent that X-ray to the radiology expert, because we always do that whenever we do any X-rays. We send them to the radiology experts. Well, unfortunately, a medical error happened. Stop there, see if she says something. If she doesn't say something, like, what, doctor, what happened? Well, the X-ray was reviewed by the expert, and he found that I missed reading the X-ray, and actually there is a foreign body or a button or a needle or a metal strip or whatever is given to you in the scenario. Please use the same word. If it's written button, say the button. If it's written coin, say the coin. If it's written foreign body, say the foreign body. Don't use your own vocabulary over the questions that have been given to you. Tell that a button has been identified in her food pipe. She'll be shouting, she'll be angry, she'll be annoyed. Start apologizing. I'm really sorry for what happened. I really do not have enough words to apologize you. I feel that I have failed to serve you as a doctor. It should not have happened. Anybody in your situation would have felt the same. I'm again really sorry for what happened. She will not be interrupting you again and again. It's not like our home countries. Usually they are quite calm as compared to the patients that we have in our countries back home. She'll be calm. Tell her that. Start giving her the solution that you did to your own mistake. All right, Jessica, I can see that. Always acknowledge. Sorry, I forgot to mention that you need to acknowledge first. Always acknowledge first. I can see that you're really annoyed and angry over what has happened. You're right. It's your right to be angry over it. And I'm really sorry. Start giving your sorries, and then tell the mother yourself, because she might not be knowing that what needs to be happened ahead. So tell her that because this mistake happened, I have already started working on correcting it for future. Do you want me to tell you what I've done? Yes, doctor, tell me, what have you done? I've documented it in her notes. I've also talked to my senior about it, and I'm going to fill an incident form which will go to the higher authorities in the hospital, where certain steps will be taken after they have read the incident report. Certain steps will be taken in order to avoid similar thing or similar mistake or similar error from happening in future. Give a pause, see if she's satisfied with that. Usually patients, if you give a good satisfactory apology, believe me, I promise you, they'll never want to go and complain against you in calls. And never ever offer calls yourself. Please, please. Pulse is a complaint service, and you do not need to be offering that to the patients if they are happy. If they are happy, that's done. You do not need to offer calls. If they are unhappy, they are not satisfied with what you are telling them, they are not satisfied with the type of apology that you've done, with the type of wording that you've used, with the type of kindness that you've showed, they might stay angry till the end and they might want to complain in the calls. But if, for example, if a patient says that I want to complain, do not think that he is angry and you failed the station. No. Sometimes they just want you to talk about calls. So do not affect your next station if by any chance this patient has talked about calls, right? Coming to the management, so you need to call this mother back to the hospital, back to the A&E to manage this child now. So this case has two tasks. One is that you need to tell the mother that what you have done to avoid similar mistake from happening in future. And the second thing is to call this child and mother back. When you call her, she might say, in all the cases, they might give you a lots of reasons for not coming. You need to address those reasons. Any case, whether that's a treatment refusal case, whether that's a misdiagnosis case, missed investigation case, medical error case, whenever your patient is refusing to stay in the hospital or to come to the hospital, go give them options. Options like what? Start with the smaller one. Like, would you be able to, let's suppose, for example, she says that I can't bring her because I'm going for work. How does, what if I give you a letter for your employer and you can show it to her? No, no, doctor, I can't do that. Is there anyone else at home who can bring her? No, doctor. Is there any way that you can arrange your meeting with us right now? Give her the option to decide something. Doctor, I really can't think of anything. I do not have a transport. Okay, I can arrange a patient transport for you. How does that sound to you? All right, that would be fine. This is how you need to give the options. If she says that I've got other kids at home who need to be taken care of, so I can't bring Emmy to the hospital, tell her that I can arrange for some social services. If, for example, in any case, so I'm giving you options overall for the whole GMC exam. They might say that they have kids at home, you can offer social services. They might say that they have a dog at home or a pet at home, you can offer them pet services. So you need to be able to offer options. You need to be able to offer them options. Let's suppose, for example, in any case, you feel lost and you are not able to find the option or a solution for the patient's reason for not coming to the hospital. You can always bring in your senior. Tell your patient that I'll talk to my senior and I'll find out the way I can help you in this regard. So you always have your senior with you whom you can consult for help. Okay, so this is the case of missed foreign body. You have to do three things. Remember again, in all these cases, missed foreign body, missed sample, blood sample, the patient's care has been compromised. Please put it in his notes, means documentation. Secondly, involve your senior. Thirdly, fill in an incident form. And if the patient is not happy, only then go to PALS. Otherwise, no. PALS is not required, right? Going to the next one again, same way, medical error, misdiagnosed pneumonia. So now this case is a little bit different. If you try to understand this case, you have given a treatment, an unneeded treatment to the patient. Whenever you've given an unneeded treatment to a patient, there can be certain important things that you need to take in the history. Compared to this one, in this one, you missed something. You missed diagnosing something, okay? In this one, you missed labeling a blood sample or you missed the blood sample itself. This one is something that can delay the patient treatment. So the patient might ask you, doctor, is my surgery going to be delayed? Well, Mr. X, I can see that you're really concerned about the delay, and I myself am concerned about that too. I'll try my best to talk to my senior, to the surgeon, to make sure that we can book you in the earliest slots for this surgery. But I really can't promise you at the moment. Never do any promises with your patients when you're not sure how is your senior going to react to this offer. So always say that I'll talk to my senior. I'll try my best to make it as early as possible for you. I'll try my best to request my senior if we do not, if we can do it on the same offered time. Okay, always give options. This patient, if for example, if he says that, doctor, I can't come to the hospital for blood sample, then give him the option of home sample collection. You can do that for him anywhere, wherever he's at home, he can get his sample collected at home, right? So options, same thing, options, options, options. Misdiagnosed pneumonia, medical error. You have treated this patient. We'll just quickly go through that because the whole management is going to be the same. Andy Parker, age 52, has presented to the clinic for review. Patient presented to the hospital 4 weeks ago with cough and shortness of breath. Investigations including blood test and X-ray were done. Patient has been diagnosed with pneumonia. Patient was admitted in the acute medical unit and then shifted to the ward. Patient has been prescribed amoxicillin. One of the doctors read another patient's X-ray by mistake and the diagnosis of pneumonia was made based on that. So if you just focus on this, one of the doctors read another patient's X-ray. It means that the mistake was on the part of the doctor, not on the part of the radiologist. It was not mislabeled. It was not mislabeled with the patient's name and date. In fact, it was misread. So when that happens, the patient needs to the doctor needs to apologize to the patient. So patient's formal X-ray report came back a few days later and it was normal. You're going to call the patient. Usually, as I said that, these are a little bit old prints. If it comes as a telephonic consultation, you're going to call with the telephonic protocol. You will always first tell the cause why you're calling. Tell him that, Mr. Andy or Mr. Parker, you presented to the hospital 4 weeks back with some cough and shortness of breath, and you were admitted here. Is that right? Yes, doctor. I'm calling to. So you, from the beginning, you're telling the patient, I'm calling to discuss about the type of management that was provided to you or about the management that was provided to you in the hospital. Are you free to talk at the moment? Yes, doctor. Would it be all right if I call you on the same number in case the call drops? Yes, doctor. Start taking the history. Ask him to recap what happened, why were you hospitalized, and how did you cope with in those 4 or 5 days when you were in the hospital? Did you have enough support? Do you have any symptoms now? Ask him about any present symptoms. Once you've asked all those questions to the patient, you go on to explain the error. When you explain the error, he'll be angry, annoyed. You are going to deal all these medical error cases in the same way. Believe me, if you practice any one case 10 times and improve your ethical and counseling skills, you'll be able to perform all of them. Any new patient coming to you in the hospital or in the practice whose management was compromised or in which a medical error happened, believe me, you are going to be the best one to deal with this patient. So try to take up one scenario and practice over being fluent, practice over being apologetic in a good way, practice over giving options. This is what you need to learn in all these medical error scenarios. Okay, so then you take a history, ask him if he had if he was given amoxicillin as it's given in the question. Yes, doctor, I was given. By any chance, did you have any side effects at that time? Like what, doctor? Any rash on your body? No, doctor. Any diarrhea? Yes or no, doctor? He might say anything. How is that diarrhea or rash now? It's all good now. I'm really glad to know. And then you go on to tell the medical error. You explain what happened. You apologize. You start giving the options. Tell him that I've already started on trying to improve our system over that. So I have documented in my notes, I've talked to my senior, and I'm going to fill in an incident form so that we prevent any similar mistakes from happening in future. Once you've told all this to the patients, usually they are very calm, nice and quiet, and they even say that, thank you, doctor, for all this. Thanks for informing me. They are very nice. Please don't consider them as the patients that we have back home. They they admit, usually in the Western world, the patients, they admit that we are humans and medical errors or human errors is a possibility. And they are happy when we acknowledge that we have made a mistake, when we agree, when we accept that we have made a mistake, they accept this fact. What you must do, you have done all that, what you must do, nothing else. Okay, so that's the end of this case as well. Any medical error you need to deal with in the same way. All right, going to the next one. So basically we have not covered 7 scenarios, we have covered more than that up to now. This will be the last one for today. Then we'll be going to a quick feedback because it's already 1 hour and 20 minutes. And let's discuss this one as the last scenario for the day, and then we'll be going for a feedback, 15 minutes feedback. Okay. So angry with a colleague. What does it mean by angry with a colleague? I've not written anything over here. Forget about this post-MI physio. Angry with a colleague. As I discussed earlier, whenever there's some patient, there's some attendant, some family member, anyone who is angry with your colleague, please never justify your colleague. Never say that he must be very busy, he must be very apologetic when he comes to know about that. He's a very good doctor, I know him very well. Please never justify him. Never justify him. You yourself don't know about him. You are just sitting in a situation where you don't know anything about what happened. So forget about giving any justification. Okay? For us, remember, as a human, you can't ever even justify your sister or brother over doing something because you can't. You are not him or her. So you can't even justify your colleague. Remember that. Instead, acknowledge that the other person is angry. Tell him that I'm sorry that he or she had to go through all this, and I'm going to look into the matter, find out the cause, that why all this happened. If you felt that the colleague was angry or rude or misbehaved, then why did he behave rudely? All right, so you are FI2 working in cardiology unit. Who your patient is? 65 years old lady admitted in the hospital with MI 2 days ago. She had angiography and angioplasty for that. Physiotherapist advised her to walk, but she is afraid. She has asked the nurse if she could talk to you. So now you already know that this patient is already waiting for you. What you must do, please talk to the patient and address her concerns. In my mocks, up till now, maximum candidates could not identify that what's the problem. Just a few number of them could identify. Remember that all the scenarios that you have in your exam, they do have some sense to them. They are not senseless. They are not nonsense. You do not have to beat around the bush. You need to be very clear about what is being asked and what is being done. So when you go in, this lady, any Bolin or whatever is the name of the patient in your exam, she might say that, doctor, I was admitted in the hospital. Okay, so you go in, you greet the patient, introduce yourself. How may I help you? I can see that you have some concerns and you want to talk to me. Is that right? Yes, doctor. So how may I help you? Doctor, I'm concerned that one of the staff members, it will be given here usually that the or it may not be given. If it won't be given, she'll tell you that I'm really concerned that one of the nurses told me not to walk. She said that I need to rest as much as I can. Whereas this physio, this rude physio, today morning, she came and she told me to walk. I really don't know what I need to do, and I really don't know why she was so rude to me. I'm not happy with that. You acknowledge her anger. I'm really sorry, Mrs. Bolin, that you, Miss Bolin, or whatever you're calling her, or any, that you had to go through this. And I can see that you're not happy with the way the nurse or the physio talked to you. I'm sorry for your experience. I'm here to help you out with this. You start asking the history. Can you tell me a bit more about what happened? She'll tell you the whole story. When she tells you, so when did this physio come? When did she ask you to walk? How are you feeling at the moment? So first take the history of what she's telling you about the nurse and the physio. Once you have taken that history, that when did the nurse ask you to not to exert yourself? Doctor, when I was admitted in the hospital, at that time the nurse came to me 2 days ago and she said that I should not be moving around. And since 2 days, I have not been moving around. Okay, that's really good that you followed her instructions. And when did the physio come and tell you that you need to move around? It's just today, after the angioplasty was done. All right, that's a very valid concern, and I'm glad that you called on one of the doctors to come and talk about this because you were confused about what's going on. Can you tell me that why were you admitted to the hospital? She'll tell you a story that she had a chest pain, shortness of breath, blah, blah, blah. All right, and do you have any symptoms now? No, doctor. Any problems that you had during the angioplasty? Was it did you remain comfortable? Yes, doctor, that was completely okay. And what route was taken to do the angioplasty? Was it through your leg or through your arm? This is a very important question. I'll tell you why. Once you've taken enough history, you go on to the management part. Before management, you can always say that I'm really glad that you're feeling well at the moment and you do not have any chest pain or shortness of breath. I'd just like to have a look at your notes or do an examination, whatever way you want to do. This is an admitted case. In terms of showing the examiner that you want to do an examination, you can just say that I'll just have a look at your notes, the post-operative or post-procedure notes, just to see that you're doing well at the moment physically. Now you come on to, so Mrs. X, the nurse, when you came to the hospital, asked you not to walk because, let me clarify your confusion. She asked you not to walk because at that time, your heart was under immense pressure, and any movement or strain or stress on the heart was not good for your heart. Okay, that's the reason the nurse on the day one, she asked you not to walk and take as much rest, do as much rest as possible. Now, since the procedure has been done, the blood supply to your heart has been revived, and we are glad that it has happened successfully. The physio came and asked you to walk because whenever a procedure is done on a patient, if they rest for a long period of time, thinking that they need to rest, and you have also been on rest for the past 2 days, there's a fear of developing clots in the legs. That's the reason the physio came in and talked to you and wanted you to walk. Oh, okay, that's the reason. Yes. Are you happy with this explanation? Are you getting my point? Or are you clear now why the two people had a different point of view about walking? Yes, doctor, I'm much clear now. So I really highly advise you to try to get up from your bed and walk around 2 to 3 times every day. Just take a round of the ward or of your room. Just be careful not to trip anywhere. She's 65. Just being careful. Nothing special, just generally this procedure might have been done through her leg. If it has been done through her leg, what's the important point? It's important for her to stay in the bed for 5 to 6 hours after the procedure that has been done in the leg. So make sure that she's not walking around too early. So once done, you thank the patient and you again tell her, I understand that you were confused about the two different things, but at the same time, Mrs. X, it's very important that you should have a good experience in the hospital, and you told me that the physio was rude to you. I'm definitely going to escalate this matter. I'll first go and talk to her, ask her to come and have a word with you as well. This should not have happened. She might be sorry for that, and she might be able to give you a better explanation for her behavior. But I'm not really sure about what exactly happened. So I'll definitely escalate it to my seniors as well. And I'll try to find out the reasons for her behavior. Okay? So you need to be able to satisfy the patient who is there in the hospital with you. This is what is needed from you in this case. All right. So that is the end of our today's workshop.